Have you ever wondered what the benefits of a natural birth is? And have you ever wondered why would anyone want a natural birth when they could have an epidural? My name is Bo, I'm an endorsed midwife and childbirth educator. And today I'd like to talk about 5 benefits of having a natural birth. So what is an epidural? An epidural is an anaesthetic that basically gives you pain relief from the waist down so that you don't feel the pain of labour, but you may feel some pressure or sensation of the baby moving through the birth canal. So the first main benefit of having a natural birth is that you're able to move freely throughout the labour and birth. And moving freely is what is known as an active birth, which offers many benefits to the woman and the baby. And some of those benefits are that the woman is able to make space in her pelvis so that the baby can descend through the pelvic inlet and through the vaginal birth canal. It also helps to decrease the intensity of pain and help you manage pain by moving and swaying and helping reduce the pain. It also means being upright in labour helps to promote baby's descent through the birth canal and often means that labour duration is reduced. One of the main challenges we see with women who are using an epidural is that women will have to remain on the bed throughout the duration of labour. They're not able to get up and walk around and mobilise, so they're not able to use gravity to their advantage to help baby to descend through the vaginal birth canal. And what can happen when you're lying on the bed during labour is that your tailbone sort of closes in against the bed, which reduces the space in the pelvic outlet for baby to be birthed. The second benefit of having a natural birth is that it reduces the risk of the cascade of intervention. Now, the cascade of intervention is a very well-researched phenomenon in maternity care. And basically it shows that whenever an intervention, a medical intervention is made throughout a woman's labour, there is an increased risk of more intervention occurring. Ideally, if we can reduce the risk of the cascade of intervention by avoiding unnecessary medical intervention, often the woman will have a more positive birth experience. So the third benefit of having a natural birth is that it optimises the natural hormonal process of labour. And this means that if we optimise the natural hormonal process, there are hormones within the body that actually helps to reduce the pain and the sensation of pain experienced by the woman. But it also promotes the fetal ejection reflex, which is basically a mechanism within the body that helps to push the baby out through the vaginal birth canal. And if we optimise the body's natural hormonal process of labour, we can reduce the need for coached pushing. And coached pushing is where your midwife or care provider coaches you through second stage, which is the pushing stage of labour. The problem with coached pushing is that often it can cause the woman to be pushing when maybe perhaps her body is not ready. This can cause some distress to baby. It can cause the duration of second stage to be longer than what might be naturally needed, and it can cause lots of problems with the second stage of labour. So if we can avoid the need for coached pushing and optimise the body's hormonal process of labour and the fetal ejection reflex, the woman can just listen to her instincts and allow baby to be birthed naturally. The fourth benefit of having a natural birth is that the body often will have an easier journey of healing after birth. So women who have a natural birth have lower risk of needing forceps, ventouse birth, which is where the doctor helps the baby to be born, and also a lower risk of cesarean or episiotomy, which is a cut in the vagina to help make space for the baby to be born. So avoiding these medical interventions means that the woman can recover more easily in the healing process after labour. And the fifth benefit of having a natural birth is that the woman will often have a more successful and enjoyable breastfeeding experience. And that is because if the woman experiences the hormonal process of labour, she's more likely to not have any interruptions in the breastfeeding experience. Because what we see at the end of pregnancy is that the prolactin, the hormone for breastfeeding, is increased, preparing for the birth of your baby. And once baby is born and the placenta is birthed, there is another increase in prolactin release in the body, which helps to establish and initiate that breastfeeding experience. So as you can see, there are so many benefits of having a natural birth without the use of an epidural. And actually there are so many active birth tools that you can utilize to help manage the pain of labor and support your body's natural hormonal process of labor so that you can have a really positive birth experience. And I'll talk about those active birth tools in another video soon. And please subscribe to our channel to learn more. If you would like to book an appointment with us, head to our website at www.athenawomensclinic.com.au.